issues are such a common issue. So many people are suffering with shoulder issues. And one of the most common causes of a shoulder issue is some problem to do with the four muscles called the rotator cuff muscles. Now, the rotator cuff muscles are responsible for most of the movement that the shoulder does. And because of poor blood supply with certain arm positions, we commonly can get a pinching of the blood supply to the rotator cuff muscles, and then over time, like all things, if there's a small problem, but then we add in days and days to months to weeks of that problem, it starts to become a bigger problem. So if we have a pinching of the nerve blood supply to the rotator cuff, we can start to get inflammation, aggravation through the rotator cuff muscle group. And that will manifest itself in pain, lack of ability to move the arm, difficulty with daily activities that you used to find very elementary, such as reaching behind you, such as, you know, if you're a female, you're doing up a bra strap. These issues can become real problematic issues, let alone lifting and carrying anything. Now, also, I must mention again that the neck is really involved in all shoulder problems. We can't just treat and deal with a shoulder problem and forget about looking at the neck. In my experience, it's really important that we understand neck mechanics, neck neurology, the neural connections between the neck and the shoulder muscles, and that we help the function of your neck because it will help the function of your shoulder. But let's talk about some simple introductory ways you can start a process of healing a rotator cuff, so a build-up of tension through the shoulder, I should say, that you may know for certain through an MRI or through an ultrasound is a rotator cuff problem. So really what we're going to do with these exercises, they're called isometric exercises. We're going to have our arm in certain positions. So first of all, we're going to have our arm by our side like this, the affected arm. And then we're going to imagine that the affected arm wants to come across our body like that. But we'll use our opposite hand against the palm of the affected arm and then we'll push our affected arm as if we're coming across the body, but the palm on your non-affected arm will stop the push. So I'm pushing, and as I'm pushing, I feel the contraction through here, bringing blood supply to that area and starting a healing process. Now, I would suggest that you need to work within your manageable pain levels, but if you can count to 10 with the push, that is fantastic. And then repeat it 3 times. Then with your arm still in this position, we want to think about the palm opening. And so we want to use the opposite hand over the top to resist the opening of the affected arm. Once again, this hand is here on my flat of my wrist. Sorry, my forearm, not my wrist. And I am going to open and work within pain thresholds, but hopefully a count of 10. And I am resisting the want of my hand to open up. And I would repeat that 3 times. Then the third one is with your arm still in this position. This time the movement is out. And so you would get your unaffected arm onto the side of your upper arm. And as you are going to lift your arm out, the unaffected arm is stopping it. And I'm pushing into my unaffected arm, count of 10, and relaxing. And repeat that 3 times. So that is a very good basic introductory isometric set of 3 exercises that you can start doing literally today if you've got nagging shoulder problems, to bring some blood supply into the area, get some flow, get some chi, get some movement through that area, and start that process of the body healing itself. If you have any questions or you need to feed back any information because you've been trying these yourself, please comment below and I'll do my very best to get back to you with a reply. Thank you for watching.